Hello future nurses confused about electrolyte imbalances. In this video, let's make potassium imbalances, that is hypokalemia and hyperkalemia, cleared, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Potassium. Normal level of potassium is 3.5 to 5 milliequivalent per liter. Potassium plays vital role in cell metabolism, cardiac contractility, transition of nerve impulses, function of muscle tissue, and acid-base balance. To remember this, we know that symbol of potassium is K, and from K we have to remember cardiac, that means heart, which means that whenever there will be potassium imbalance, heart symptoms will dominate, ECG changes and cardiac dysrhythmias may occur that can be life threatening. Now, the normal level of potassium is 3.5 to 5 milliequivalent per liter. Two conditions occur when potassium is out of balance: hypokalemia and hyperkalemia. In this video, let's discuss hypokalemia. Hypokalemia. Serum potassium level is less than 3.5 milliequivalent per liter. Means in the condition of hypokalemia, the potassium level is less than normal, that is less than 3.5 milliequivalent per liter. Let's discuss the causes of hypokalemia. We know there are number of potassium rich sources and one of the potassium rich sources is potato. So if one doesn't consume adequate potatoes, we can say, then there can be potassium imbalance in the body. So to remember the causes of hypokalemia, we can remember the mnemonic potato. That means why there is hypokalemia, because there is less intake of potato, that is less intake of potassium. So this is the way we can remember the causes of hypokalemia. P stands for poor intake of potassium. If person is fasting, is NPO, nothing by mouth or nothing per oral, malnourished, the potassium intake is low, and due to which there is no stored potassium in the body and deficiency occurs, which is hypokalemia. O stands for output increased, more potassium loss due to vomiting, diarrhea, wound drainage, or prolonged nasogastric suction. If there is increased output, means increased loss of potassium, then also there is less potassium in the body and the condition of hypokalemia. And due to which reasons potassium is lost from the body? Due to vomiting, diarrhea, wound drainage, or prolonged nasogastric suction. T stands for too much use of diuretics. If there is increased use of loop diuretics, thiazide diuretics, then these diuretics increase urine output, and along with sodium and water, potassium is also lost from the body, and result is decreased potassium in the body. A stands for alkalosis. We know in alkalosis, hydrogen ions move out of the cells into the blood, and to when means when hydrogen ions will move out of the cells, and in exchange potassium moves into the cells, and as a result there will be less potassium in the blood. So this is serum hypokalemia develops. T stands for too much secretion of aldosterone, as in Cushing syndrome. Cushing syndrome is a condition in which there is too much, means excess aldosterone is secreted, and because of excess aldosterone, more sodium and water is retained and more potassium is excreted by the kidneys, leading to hypokalemia. O stands for other electrolyte imbalances, mainly low magnesium. If there is low magnesium, then low magnesium will increase potassium loss through the urine and will also prevent potassium reabsorption, and the result will be low potassium. And if we have to correct potassium imbalance, then first we have to correct magnesium imbalance, because potassium will not improve until magnesium is not corrected. So we have to always keep in mind, whenever we are correcting potassium imbalance, we have to check the level of magnesium in the body. So these are the causes of hypokalemia. Potato: poor intake of potassium, increased loss, too much use of diuretics; alkalosis, too much secretion of aldosterone; and other electrolyte imbalance, that is mainly low magnesium. Clinical manifestations of hypokalemia. What signs and symptoms will appear if the person is having low potassium? And the mnemonic to remember clinical manifestations is low potash. Low potash itself suggests that there is low potassium in the body. L. L stands for lethargy, low and slow bowels, that is constipation, and loss of reflexes, that is hyporeflexia. We know that potassium is necessary for nerve and muscle excitability. So now in this condition, potassium is low. That means nerve impulses will slow down, which will cause lethargy, slow bowel movements causes constipation, and there is loss of reflexes too, which is hyporeflexia. O stands for orthostatic hypotension. Potassium, if there is less potassium in the body, then there will be poor vasoconstriction, and due to this, whenever person will stand from a sitting or from a lying position, then there will be drop in bp, that is known as orthostatic hypotension will occur. W stands for weak irregular pulse. Due to low potassium, there will be weak contractility of heart muscles, and weak contraction of heart, due to weak contraction of heart, there thready weak pulse or irregular pulse will be the sign of hypokalemia. P stands for paralysis, means muscle weakness, respiratory muscle weakness or respiratory failure due to muscle weakness may also occur. O. Output increase, urinary. Due to less potassium, urinary output increases because due to less potassium, the kidneys will not be able to concentrate urine. If urine is not concentrated, means there is increased loss of waste products, and along with that, uh, more potassium or more sodium and water is excreted, so kidney function is impaired because of less potassium. That is why there is increased urinary output. T stands for T wave depression and other ECG changes. Due to less potassium in the body, various ECG changes occurs including T wave depression. A. Anxiety, confusion, abdominal distension, nausea, and vomiting. Potassium deficiency will reduce GI motility, due to which abdominal distension occurs, nausea and vomiting as a result occurs. Also, person will be anxious, confused, and in severe cases, the person may go into coma. S stands for shallow ineffective respirations. As we already discussed that respiratory muscles will become weak, and due to weakness of respiratory muscles, there is hypoventilation, and in severe cases respiratory failure may also occur. S stands for skeletal muscle cramps and skeletal muscle weakness. Hypokalemia will reduce muscle contraction, due to which muscle cramps, spasms, and muscle weakness will appear. So these are the clinical manifestations of hypokalemia that we have to remember by the mnemonic: low potash, lethargy, constipation, hyperreflexia, orthostatic hypotension, weak irregular pulse, paralysis, increased output, ECG changes, anxiety, abdominal distension, shallow infective respiration, skeletal muscle cramps, and weakness. Let's discuss the ECG changes that occurs due to hypokalemia. ECG changes include shallow, flattened, or inverted T wave, prominent U wave, ST segment depression. This is a normal ECG. As we can see, the P wave, the QRS complex, T wave, the QT, and PR interval. This is a normal ECG pattern. This is the ECG in case of hypokalemia. As we can see, the ST segment is depressed. So ST segment depression. Here the T wave is flat or shallow, we can say. Also in some cases there is inverted T wave. U wave. As we can see in normal ECG, the U wave is not prominent. But in the case of hypokalemia, there is prominent U wave. So this is the these are the ECG changes that occur in hypokalemia. ST segment is depressed, T wave is flattened, inverted or shallow, and prominent U wave. And to remember these ECG changes, we have a mnemonic that is low K makes T low and U shoes. Means low potassium will make T low. Means T is shallow, flattened or inverted. And U shoes. That means prominent U wave. So this is a mnemonic to remember the ECG changes in hypokalemia. Low K means low potassium makes T low and U shoes. Let's discuss the management. How we will manage the condition of hypokalemia. In hypokalemia, there is less potassium. So to manage this condition, we have to give potassium to the person. So the mnemonic is potassium for management. P. P stands for potassium rich foods. We have to give potassium rich foods to the patient with hypokalemia. And potassium rich diet includes bananas, oranges, spinach, potatoes, tomatoes, and coconut water. These are the safe ways to restore potassium. O stands for oral potassium supplements. We can, if there is increased loss of potassium or if the potassium level is too low and diet is diet is not enough to restore that level of potassium, then we have to give oral potassium supplements. Potassium chloride tablets or liquids we can give to the patient. T stands for timely monitoring for cardiac changes. As we know that potassium imbalance directly affects the heart rhythm, so we have to continuously monitor the ECG changes in case of hypokalemia. A. Avoid potassium losing diuretics. We have to avoid loop and thiazide diuretics, and we have to prefer potassium sparing diuretics so that less potassium is excreted from the body. So avoid potassium losing diuretics and prescribe potassium sparing diuretics. S. Safety measures for client experiencing muscle weakness. The client or the patient will experience muscle weakness, so we have to give prevent the person and we have to provide safety measures. As slow IV infusion, whenever we are giving IV potassium, mainly in severe cases of hypokalemia, then we have to give slowly. The IV infusion is given slowly and never ever IV potassium is given as a bolus. So this is then important whenever we are giving potassium IV. I stands for intravenously administered potassium. We can give potassium IV, but in the diluted form. U stands for urine output monitoring. As we know before giving potassium, we know that potassium is excreted by the kidneys. So we have to ensure that urine output is normal. The normal urine output is more than or equal to 30 ml per hour before giving potassium, because by checking this we will know that whether kidneys are functioning properly or not, because kidneys will excrete potassium. So if kidneys are functioning properly, then only potassium will be excreted. If there is increased, in case hyperkalemia develops while we are treating hypokalemia, there is increased potassium in the body when we are giving IV potassium or we are giving oral supplements of potassium, so we have to check kidney function prior to giving potassium. Monitor ECG changes and electrolytes value, especially magnesium. We have to monitor ECG changes for cardiac dysrhythmias and electrolyte balance or electrolyte values, mainly of magnesium, because if magnesium is low, then potassium will not be corrected. So this is the management of hypokalemia. And for management of hypokalemia, we have to remember the mnemonic potassium. Potassium rich foods, oral potassium supplements, timely monitoring for cardiac changes, avoid potassium losing diuretics, and we have to prescribe potassium sparing diuretics. Safety measures, slow IV infusion, IV administered potassium, urine output monitoring, and monitor for ECG changes and electrolytes value. Helpful tip: potassium is never given by IV push or IV bolus, intramuscular or subcutaneous route. Whenever we are giving potassium, we can give by IV route, but IV push or IV bolus is not given. And never potassium is given by IM or subcutaneous route. IV potassium is always given in dilution and administered using an infusion pump. Dilution of no more than 1 milliequivalent per 10 ml is recommended. As we already discussed that IV potassium is not given by IV potassium is always given in dilution, never by IV push or IV bolus. And for giving IV potassium, we have to use infusion pumps. And to dilute potassium, dilution of no more than 1 milliequivalent per 10 ml means 1 milliequivalent of potassium in 10 ml of NS. We have to dilute before giving. Potassium infusion can cause phlebitis. Assess IV sites for signs of phlebitis and infiltration. If we are giving potassium IV, phlebitis can occur, so we have to continuously assess the IV site for signs of phlebitis and infiltration. Potassium is safest infused through a central line. Central line is the safest to infuse potassium, because if potassium is infused through central line, then the chances of phlebitis and infiltration reduce. So these are the tips that you have to remember whenever you are giving potassium by IV. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.